Hello, my name is Lionel Subaya. Today I'm going to demonstrate care for nasal gastric tube, inserting a nasal gastric tube. This method of introducing a tube through nose into stomach. The purposes are to feed the client with fluids when oral intake is not possible, to dilute and remove consumed poison, to instill ice-cold solution to control gastric bleeding, to prevent stress and operated site by decompressing stomach of decretion in gas, and also to relieve vomiting and distension. Here's the equipment that we're going to use for our procedure. First one is stethoscope, marker pen, syringe 10 ml. We have gastric tube or nasal gastric tube. We have clamp, lubricant. We have adhesive tape, cotton balls, disposable gloves, kidney tray, and steel tray. Check the doctor's order for insertion of nasal gastric tube. This clarifies procedure and type of equipment required. Gather the equipments. Organization provides accurate skills performance. Client privacy, close windows and doors. Assess client's abdomen. Assessment determines presence of bowel sounds and amount of abdominal distension. Perform hand hygiene. Wear disposable gloves if available. Hand hygiene deters the spread of microorganisms. But the sterile technique is not needed because the digestive tract is not sterile. Gloves protect from exposure of blood or body fluids. Assist the client to high Fowler's position or 45 degrees, if unavailable to maintain upright position. Upright position is more natural for swallowing and protects against aspiration if the client should vomit. Checking the nostril. Tube passes more easily through the nostrils with the largest opening. Check the nares for patency by asking the client to occlude one nostril and breathe normally through the other. Clean the nares by using cotton balls. Select the nostrils through which air passes more easily. Measure the distance to insert the tube by place the tip of the lobe at client's nostril extending to the tip of earlobe. Extend it to the tip of xiphoid's process. Mark the tube with a marker pen or a piece of tape. Measurement ensure that the tube will long enough to enter the client's stomach. Lubricant the tip of the tube at least 1 to 2 inches with water solution lubricant. Lubricant reduces friction and facilitates passage of the tube into the stomach. Inserting the tube into nostrils while directing the tube downward and backward. Following the normal contour of the nasal passage while inserting the tube reduces irritation and the likelihood of mucosal injury. The client may gag when the tube reaches the pharynx. The gag reflex stimulated by the tube. Instruct the client to touch his chin to his chest. Encourage him or her to swallow even if no fluids are permitted. Swallowing helps advance the tube, causes the epiglottis to cover the opening of trachea, and helps to eliminate gagging and coughing. Advance the tube in a downward and backward direction when the client swallows. Stop when the client breathes. If gagging and coughing persist, check placement of the tube with a tongue depressor or flashes if necessary. Excessive coughing and gagging may occur if the tube has curled into the back of the throat. Keep advancing the tube until the marking of the tape marking is reached. Do not use force. Rotate the tube if it meets the resistance. Forcing the tube may injure mucous membranes. While keeping one hand on the tube, verify the tube placement in the stomach. Attach syringe to the end of the tube and aspirate small amount of stomach contents. Visualize aspirated content, checking for the color and consistency. The tube is in the stomach if its content can be aspirated. Inject a small amount of air, 10 to 15 ml, into the nasogastric tube while you listen with the stethoscope approximately 10 inches or above 8 cm below the sternum. Secure the tube with tape to the client's nose. Be careful not to pull the tube too tightly against the nose. Constant pressure of the tube against the skin and mucous membranes cause tissue injury. Clamp the end of nasal-gastric tube while you bend the tube by fingers not to open. Bending the tube prevents the inducing of secretions. Put off and dispose the gloves. Perform hand hygiene to prevent the spread of infection. Replace and properly dispose the equipment to prepare for the next procedure. Record the date and time, the size of the nasal gastric tube, the amount and color of drainage aspirated, and relevant client's reactions. Sign the chart. Documentation provides coordination of care. Report to the senior staff to provide continuity of care.